And hello again from Fox News in Washington. We saw major action by the FDA and CDC this week to approve booster shots for millions of more Americans. And also new guidance on mix and match, getting the initial dose of one vaccine and then a booster shot of another. Plus, public health agencies are getting closer to approving COVID vaccines for children under 12. And the controversy continues over public agencies and private companies imposing vaccine mandates on their employees. All this as Americans try to prepare for the holiday season. As you can see, there's plenty to discuss with the director of the Centers for Disease Control, Dr. Rochelle Walensky. Doctor, welcome back to Fox News Sunday.
Thanks for having me. Good morning, Chris.
So, as we said, the CDC this week approved the Moderna and J&J vaccines for millions of more Americans, as well as approving mix and match. You say that it's a personal option as to the individual whether they want to get the initial dose of one vaccine and then the booster of another vaccine. But isn't the data clear that if you got the J&J booster first, that you get much more protection by getting a booster from either Pfizer or Moderna?
So this is an important next step in our booster plan across this country, because right now we have a booster plan for every one of the vaccines that we are using. As you noted, the Moderna vaccine will also be eligible for boosting the same way the Pfizer is, as well as a booster plan for J&J 2 months after your initial dose. We also approved a plan so that we can move forward with mix and match. But specifically to your question, we saw data, the FDA and the CDC saw important data from the NIH on the mix and match approach, and how when you boost a J&J vaccine with a Pfizer or Moderna vaccine, you get a really good antibody response. We also saw clinical data from J&J themselves that when you boost the J&J with a J&J vaccine, that you actually get really good effectiveness there as well. So that is really why we left it to the people, because quite honestly, most people did really well with their initial vaccine series. The vast majority of people did really well. We have 410 million people who've been vaccinated, or 410 million vaccines that have been given. And so people may very well want to pick the one that they got before. However, if you want something else, we left that option up to you.
Just briefly, though, according to the data, if you get the J&J booster after the J&J initial dose, it boosted your antibodies 4-fold. If you got the Moderna booster after J&J, it boosted your antibodies 76-fold. I mean, if you were talking to your friend or a relative, it seems like it's a no-brainer.
Well, so we have different kinds of data. That's data in the lab and antibody response. But we saw data in people and clinical effectiveness that demonstrated a really good response to J&J as well. So I think I would really leave it up to the clinical situation if I was talking to a specific person. People who did well with J&J may want it again, but they may very well want an mRNA, and that would be absolutely fine, too.
Could you, at some point, change the definition of what it means to be fully vaccinated to the initial dose plus the booster, that's going to be what it means?
The definition of fully vaccinated is Pfizer or Moderna. After you've received 2 doses, you are considered fully vaccinated. And after J&J, a single dose, you are considered fully vaccinated. I want to be very clear about that.
So the boosters are not going to change that definition, at least at this point?
We don't have a plan to change that definition right now.
The FDA advisory panel will vote this week on whether to approve emergency use of the Pfizer vaccine for 28 million children ages 5 to 11, and the CDC panel is supposed to meet the week after next, the first week of November. Assuming everything goes well, how soon could you be sitting there as a CDC director saying, kids 5 to 11, it's safe to get a vaccine?
We know how many parents are interested in getting their children between 5 and 11 vaccinated, and we intend to act as quickly as we can. So importantly, as you note, the FDA will meet this week. Soon thereafter, after they are able to review all the science and conduct the regulatory action, the CDC will meet. And if all of that goes smoothly, after reviewing all that science and doing the proper scientific due diligence, we will act quickly. What I can also say is, in the meantime, there's important logistical and operational operational plans that are underway so that that vaccine will be out in the field as soon as we take action.
Look, it's one thing to say whether you're going to get a vaccine. It's another thing to say whether you're going to let your 5-year-old get a vaccine. And in a poll that just came out, only a third of parents said that they would be willing to let their children, even if it's approved by the FDA and CDC, let small children get the vaccine, quote, right away. How tough do you think it is going to be to convince parents, once you go through all of these approvals, that it's safe to get a 5 to 11-year-old, give them a vaccine? And should, at that point, should schools mandate that kids of this age get the vaccine as they do lots of other vaccines?
Right. So we have, I'm really excited and enthusiastic about reviewing this science, and I'm really hopeful that in that proper review, we will get to a place where we have a vaccine for 5 to 11-year-olds. When and if we do, we have a lot of parents, as you noted, a third who are ready to get their children vaccinated right away. And we know we have a lot of work ahead of us, just as we did with the initial vaccine. These numbers are exactly the same as they were late December last year when the initial vaccine rolled out. And yet today we have over nearly 80% of people who've received their first dose. So we have to do all of that hard work again, education, communication, so that we can get parents comfortable with getting their children vaccinated, where so many parents are already.
How would you feel about schools mandating those vaccines once they're fully approved?
You know, right now we are at authorization. We're having discussions about authorization. So I think we need to, get children vaccinated through this authorization and get to approval before we can make a judgment there.
Let's talk about mandates for adults. President Biden was asked about the quite controversial mandates for essential workers at his town hall this week. Take a look at his answer.
Should police officers, emergency responders, be mandated to get vaccines? And if not, should they be stay at home or let go?
Yes and yes.
Now, mandates by government, by private companies of essential workers have generally worked. You see a big boost in vaccinations, even though there may be some grousing. But as you know, there are cases where police officers or health workers or pilots are walking off the job rather than get the vaccine. Are you still full speed ahead on mandates for essential workers to get vaccinated?
We have seen that these mandates are getting more and more people vaccinated. Here's what we know. The most disruptive thing that you can do to a workforce is to have a COVID outbreak in that workforce. That will most definitely not only send people home, but it will send people to the hospital, and some may pass. What we know from the police workforce is that there have been more deaths from the coronavirus over the last year and a half than all other causes of death for that workforce combined. So we believe it is very important to get these people vaccinated. There is a plan, should these people not want to be vaccinated, towards education and counseling to get people the information they need so that they are feeling comfortable in getting vaccinated.
But what about the argument that we're talking about public health here, and if you get it, and we've seen some real resistance, for instance, in the Chicago Police Department, in the interest of public health on vaccinations, if you have a large part of a police force leaving, in terms of public health, aren't you further behind the ball rather than having made gains?
You know, the way you can down a police force is by having a COVID outbreak in that police force. So what we're working to do is mitigate that from happening.
Finally, let's talk about where we are on COVID, and let me put some of the latest stats up. Cases are down more than 50% in the last month, but we're still seeing an average of more than 73,000 new cases a day and more than 1,500 deaths a day, which is still pretty bad. So, first of all, where are we on the Delta wave?
So I think the numbers actually speak for themselves. You're absolutely right. Cases are down. They're down more than 50% from where they were in September. But we can't get complacent yet. As we said, 75,000 cases a day, 1,500 deaths a day. The good news compared to where we were a year ago is that we have vaccines that work and that we have a lot of science that demonstrates how we can protect ourselves and how we can get cases down further. We know it's critically important to get people vaccinated, all those 64 million people who have not yet been vaccinated, and then with scientific review, if we have a vaccine for our 5 to 11-year-olds, working to get them vaccinated, and in the meantime, practicing all the proper mitigation strategies so that we can get those case numbers and death numbers down.
So do you believe that we are in the downturn of the Delta wave, that the spike is over and it's heading out?
You know, I'm really encouraged to watch the numbers go down. The last several days, they've been hanging out at around 75,000, and so we still have some hard work ahead of us in order to bring those numbers down to where they were in May and June.
And what about, and you hear people talk about this, what about the chances of another fifth wave of the virus as the weather begins to get colder and people start spending more time indoors?
Well, I'm encouraged by numbers coming down right now, but I have learned that we can't be complacent and that we need to be humble and that the virus tends to find places that are under-vaccinated. So as our case numbers come down, we need to continue to do the hard work of getting more and more people vaccinated to prevent exactly what you described.
You know, there's a lot of good sports on TV these days, and if you watch sports, whether it's football games and stadiums or playoffs and baseball, you got some pictures up on the screen right now, Doctor, you see hundreds, thousands, tens of thousands of people all packed together, not a mask in sight. I understand it's outdoors, but what does it tell you that there have not been spikes in most of these communities when you have people crowded into football or baseball stadiums?
We would still encourage people who are unvaccinated to wear a mask in those situations, but given that these games are outdoors, that tends to be a much safer environment.
Finally, the holidays. First of all, Halloween. What would you say that kids can do and can't do?
I would say put on those costumes, stay outside, and enjoy your trick-or-treating.
Whether people are vaccinated or not, as long as you're outside, you're safe?
Yeah, I wouldn't gather in large settings outside and do screaming like you're seeing in those football games if you're unvaccinated, those kids that are unvaccinated. But if you're spread out doing your trick-or-treating, that should be very safe for your children.
And what about Thanksgiving and Christmas?
You know, it's critically important that we gather, that we be together with our family and friends during these holidays, and we have the prevention strategies that we know work to be safe for those holidays. So what I would say is get yourself vaccinated before you gather. It will absolutely be safer if you're vaccinated. Any activity that is outdoors is safer than it is if it's indoors. And if you're gathering multiple households, make sure as many people are vaccinated as possible so you can protect the people who are vulnerable, who might not yet be vaccinated, our young children, our elderly, and then do all those prevention strategies that we know work before you arrive and as you arrive to make sure that everybody can be safe for the holidays and make sure that you're well as you gather.
Dr. Walensky, thank you. Thanks for your time this Sunday. A lot of good advice there. Always good to talk with you.
Likewise. Thanks so much, Chris.
Hi, everyone. I'm Brian Kilmeade. I want you to do me a favor. I want you to click to subscribe to the Fox News YouTube page. This is the only way that I know for sure that you're not going to miss any great commentary, any great news bites, any great interviews coming your way on Fox. You can get it all here on YouTube. So subscribe right now.